So what does disclosure mean? In simple terms, disclosure is about customers telling us the truth about their circumstances. We use your answers as the basis of our risk assessment, taking into account your personal, medical and family history information. So why is disclosure of medical history and personal information important when applying for life insurance? What you tell us on your application, intentionally or unintentionally, can impact on a claim being paid. The insurance industry have recently experienced a higher than normal level of non-disclosure in recent times. Insurers want to pay claims, and most claims are paid. Often those that are not paid are related to non-disclosure. A large percentage of life insurance applications are approved, even if you have a compromised medical history. Disclosing information up front protects your insurance policy into the foreseeable future. So remember to answer questions honestly. What are some common examples of disclosures? Joint-related injuries, for example, back or knee, depression or anxiety for which you have seen a doctor for, family histories of disease, for example, cancers or heart disease. What are some examples of non-disclosures? We had a young 33-year-old male whose family claimed on his life insurance policy for hepatitis C. He did not disclose his previous drug use. The hepatitis C was as a result of his drug use, and unfortunately we had to deny the claim as a result of the non-disclosed drug use. We also recently had a young 22-year-old female who came to us for a trauma claim. Unfortunately, she failed to disclose that she had multiple sclerosis and the claim was denied. Unfortunately, she failed to disclose that she had multiple sclerosis and her symptoms were numbness of the left leg, impaired vision, and she was very unbalanced on her feet. What does it mean to have an exclusion on a life insurance policy? If you do have an exclusion, cover is accepted, but the specific condition is excluded. For example, if a customer has a bad back, the back will be excluded. However, you can still obtain cover for all other conditions. What does it mean to have a loading on a life insurance policy? Having a loading means that a customer has a particular disease or disorder that they will cover for, but they pay an extra premium compared to a standard rates customer. Do customers need to disclose that their medical circumstances have changed after taking out their policy? After you have had your policy accepted, you do not need to notify us of a change in any circumstances unless you are going to increase the level of cover. General insurance differs from life insurance in that for general insurance, it's a renewable contract. Each year, the insurance company reviews your risk levels, how circumstances have changed, and considers whether they want to insure you. Life insurance, however, is a guaranteed renewable product, which means you are assessed up front based on the medical history and health at the time of taking out your insurance. Remember to always disclose your complete medical history when completing your application, so your insurance company can help you should you ever need to make a claim.